Thank you again for tuning in. As I said, my name is Christina Sire, and I am excited to introduce our speakers today, starting with Dr. Gary Beasley, who is a pediatric cardiologist in Iowa City. He received his medical degree from Virginia Commonwealth University School of Medicine and has been in practice for over 6 years. He specializes in pediatric heart failure, cardio-oncology, mechanical circulatory support, and heart transplantation. He currently serves as the medical director for the Pediatric Heart Failure and Transplant Program and is the co-medical director for Project Adam Iowa Heartland. We are also joined by Trudy Pierick, who is a nurse practitioner in cardiology at the Department of Pediatrics at the University of Iowa. She provides care at Stead Family Children's Hospital, and she also serves as the co-medical director for Project Adam Iowa Heartland. And then last but certainly not least, we have Brenda Haag, who is a nurse coordinator who specializes in adult and pediatric services at the University of Healthcare. So thank you so much for being here and being willing to spend your lunch hour with us, both participants and speakers. I'm going to go ahead and stop sharing my screen so I can hand it over to our wonderful presenters today. So please feel free to take it from here.
All right. Please let me know if that doesn't look all right. Otherwise, we'll continue. All right. So thank you for having us. So as mentioned, I'm Gary Beasley. I'm one of the pediatric cardiologists. And we're going to talk to you guys today about Project Adam Iowa Heartland and what it is that we are trying to do across the state. So our objectives are to define and discuss the importance of sudden cardiac arrest, discuss Project Adam and the Heart Safe School designation that we provide, and to discuss Project Adam Iowa Heartland specifically. So let's start off with what's the importance of cardiac arrest. So before we get into the nitty-gritty, let's kind of make a distinction between cardiac arrest and heart attack. Excuse me. So sudden cardiac arrest is a condition in which the heart suddenly and unexpectedly stops beating. When this happens, blood stops flowing to the brain and other vital organs. Sudden cardiac arrest is an electrical issue versus a heart attack, which is more of a plumbing issue where the arteries of the coronary arteries that supply blood to the heart muscle itself end up getting clogged. Now, a heart attack can lead to a sudden cardiac arrest. So the two are linked, but they can actually be two very separate and distinct entities as well. We also know that sudden cardiac arrest can happen in individuals of any age that have conditions that put them at risk for sudden cardiac arrest, or in people who are completely and totally quote unquote healthy. We also know that sudden cardiac arrest can unfortunately result in neurologic impairment or even death. And studies have shown that a prompt response by bystanders performing cardiopulmonary resuscitation or CPR and using an automated external defibrillator or an AED can double or even triple survival rates. So it's really important that we have trained individuals and teams, and that those trained individuals and teams can actually be very instrumental in saving lives. Let's talk about sudden cardiac arrest outcomes. So there's about 350,000 sudden cardiac arrests out of hospital that occur every single year, of which about 7,000 of those are actually children. So it's not an insignificant amount. In Iowa, that equates to roughly about 600 to 650 kids a year that will suffer cardiac arrest outside of the hospital. Nationally, the survival rate, unfortunately, is abysmal. It's 12%. We know that the average EMS response time across the nation is about 8 to 10 minutes. In some of our more rural communities in Iowa, that response time may be 12 minutes, 15, 20 minutes. And for just 3 to 5 minutes of unresponsiveness, the brain begins to undergo damage. After 3 minutes, every minute after that, the chance of survival decreases by 10%. So to show that sort of graphically, first 3 minutes, there's a decline, but it gets much steeper after you get past that first 3 minutes. And so by 10 minutes, you've got, at best, a 30% chance of survival. At 15 minutes, it's essentially zero. So we talk about hands-only CPR. And we do that for several different reasons. One, we know most lay providers are more comfortable with providing just hands-only rather than doing the mouth-to-mouth rescue breathing. But we also know that hands-only CPR, high-quality hands-only CPR, is what's really the most effective. So CPR in itself is inherently an inefficient process. It only provides about 10 to 30% of normal blood flow to the heart and 30 to 40% of normal blood flow to the brain. and that's when it's delivered in expert hands. This inefficiency highlights the need for trained rescuers to deliver high-quality CPR. If we look across the United States, this is a map of that shows which schools or which states, excuse me, have laws that require CPR training in high schools. And you can see that the ones in blue, which is a majority of the states, had laws before 2018. Unfortunately, there still are a handful of schools in that gray coloration, or states in that gray coloration there, that do not have any laws requiring students to be taught CPR. But certainly, if every student across the country was taught CPR in high school, we'd have a nation of lifesavers. Why do we focus on school and talk about school so much? Well, we know that any given day, approximately 20% of the community, adults and children, are in our schools. Again, talking about some of our rural communities, we know that the schools can really be the hub of that entire community. You know, if it's football season, the majority of that community may very well be at the football field that Friday night watching the game. And so really having as much of that school integrated in the community and prepared for a sudden cardiac arrest as possible really increases the chance of survival. We also know that sudden cardiac death is the leading cause of death in young athletes during exercise. And so if we can target a population to try and intervene, we can be effective in that age group. So is there evidence to say that school CPR and AED programs are actually effective at saving lives? This study is a little old now. It took place from 2009 to 2011, and it looked at just over 2,000 schools. And what they were really looking at was what was the survival to hospital discharge should a sudden cardiac arrest occur. During that study period, they had 59 cases of confirmed sudden cardiac arrest, which equates to about 1 in every 36 schools. Interestingly, the rate of having a fire in a school is also about 1 in 30 to 1 in 35. So it's a very similar incidence to having a fire in a school. In this study, 66% of the cases occurred during athletic events. 44% of the sudden cardiac arrests were in students, with 56% being in adults. 85% of the cases, an AED was applied, and in 66% of the cases, a shock was actually delivered. And that's an important point to bring up too, is that we talk about using the AED, and the AED will prompt you either to deliver a shock, or it may prompt you to not deliver a shock, because not every sudden cardiac arrest will actually respond to that shock that may be needed. So what this study showed was that 80% of the sudden cardiac arrest victims survived to hospital discharge if the school applied the AED, versus only 50% surviving if the AED was brought by the responding EMS team. The survival rate was also about 80% for schools with an established cardiac emergency response plan versus 44% for those without. So it really shows that having a plan and being trained and knowing how to implement that plan can dramatically increase your chance of survival. So I'll ask the question. I'm not expecting anyone to necessarily raise their hand and answer it, but in most communities across the United States, what do we think the incidence of bystander CPR is? Less than 1%? 10, 30, 40, or 80%? It's a little bit of a trick question because it kind of depends on the community that you live in. Most communities would say that they're probably about a 10% bystander CPR rate. There are some communities, particularly those that focus more on a concerted effort to train individuals, will have as high as a 30% bystander rate. People always ask, I'm scared to do CPR. Am I going to hurt someone? The answer is no, you're not going to kill someone by doing CPR or using an AED, but you can in fact save a life. If that person has had an arrest or has had a medical condition that has caused them to be unresponsive to the point that you're doing CPR and they're not responding, the best thing you can do is to do CPR and try to save their life. It also means a lot of people also ask the question of, am I going to be liable? And every state has a Good Samaritan law, so that if you are doing CPR and applying the AED in good faith, trying to save someone's life, that you are protected by that Good Samaritan law. And with that, I'll turn it over to talk about Project Adam more specifically.
Thanks, Gary. Can you just be on standby to be my advanced slides?
Absolutely.
Okay, next slide. So Project Adam is a national initiative Actually, Adam does stand for a person, but the Adam in Project Adam stands for automated defibrillators in Adam's memory. And Adam was a high school student who played basketball and was at basketball practice, completed that, and then had a collapse, which was not recognized as a sudden cardiac arrest and therefore was not responded to appropriately. So he ended up passing away. This this organization is an initiative to prevent sudden cardiac death from sudden cardiac arrest. It actually started in November of 1999 from collaborative efforts of Adam's family and his cardiologist time, who is Dr. Stu Berger from the University of Milwaukee. It is a school CPR-AED program. Next slide. And that's a photo of Adam there. Sorry, there's just a little delay in the slides advancing, and I don't quite have them memorized. So what is the mission of Project Adam? There are several, basically to increase education and awareness of sudden cardiac arrest and sudden cardiac death. Also provide advocacy for use of CPR and AED education for all students prior to high school graduation. Looking back to Dr. Beasley's map that he shared, you could see that Iowa was one of the first states in the nation to actually get that into law. And then also looking for advocacy for our AED program in all schools. And advocacy, cardiac emergency response, or levels. There's current legislation actually working on in Iowa. And hopefully within the getting us.
We're losing you, Trudy. Can you hear us, Trudy?
Sorry, I'm not getting advancement. Can you hear me?
You were cutting out there quite a bit.
Oh, my slides are not working.
Is that better?
There we go. So is it a better connection now?
Yep.
Okay. So listed here is a different map that shows the established affiliate sites for Project Adam. To date, we have 53 programs nationally in 34 states. Some of the states have more than one affiliate, and that is because they have larger population areas that they need to cover specifically. So in Pittsburgh, they kind of split the state. In Iowa, we are the lone program, so we cover the entire state. And these are logos of children's hospitals that have taken on this endeavor to better serve the children in the school system. Next slide. So one remarkable statistic is over 200 now. We're totaling 225 lives saved since 1999 because of Project Adam. Next slide. What does it mean to be a heart-safe school? So there are requirements to become a heart-safe school. Number one is that there is a sufficient number of accessible, properly maintained, and inspected AEDs. This means that the school doesn't just have an AED, but that people know where it is, that it is working and functional when it needs to be, including battery and pad life. And then also that someone in the school is responsible for making sure that it is up to date and ready to be used. Next, there are signs that are required to identify where AEDs are located. Sometimes it's easy to identify, sometimes it's difficult to find them. So as you can see from the top picture, there are different ways that you can you can have signage that shows there is an AED on location. And then our third requirement is that your first shock by the AED is delivered within 2 to 3 minutes. So this is something that the team will work on. Beyond that, there should be a sufficient number of people that are able to respond to a plan. And so that involves a cardiac emergency response plan that is developed by nursing staff or other administrative staff within a school. The cardiac emergency response team can be made up of any employees of the school. We often find that key employees that will be involved are a nurse, PE teacher, athletic trainer, or someone that has some medical experience. Some schools have SROs that are on duty and also provide a part of the response team. These responders need to have CPR-AED training and be able to respond both during school hours and after school hours if there are events. We recommend that at least 10% of staff, or anywhere from 5 to 10 staff members with current CPR and AED education and training, make up this cardiac emergency response team. And the performance of at least one drill requiring an emergency response should be done annually to maintain their heart safe school status. Next slide. So as Gary already talked about, the need for CPR or cardiac emergency is about the same as the need for a response to a fire in a school. Similar to fire drills and tornado drills, we recommend doing CPR drills because this allows the team to almost perform an automatic response so that it isn't something that they have to put a lot of thinking into. It's something that they automatically respond to. Next slide. So with a heart safe school, this is one of the schools that pictured here on the right side. By becoming heart safe, the school is prepared to appropriately respond to a sudden cardiac arrest on campus, potentially saving the life of either a student, a staff member, or a visitor, whether that be a relative or if it be someone that is volunteering or visiting the school. Next slide. Sorry for this delay. So when the school becomes designated as heart safe, we give them a certificate as well as the banner. So with access to us, they can receive education and resources, not just on their journey to become heart safe, but also after that journey, including debriefing if there is an event, as well as assistance with training as needed. We do supply replacement batteries and pads for the AED if it is used. And then we offer local, regional, and state recognition by receiving this special banner that you can see for the elementary school that is highlighted here. Next slide.
Okay, that's going to be me. So, my name's Brenda. Shout out to all the school nurses because is it Nurse Day? It was Nurse Day yesterday or Nurses Week. So, celebrate all that you guys do. I will talk a little bit about Project Adam Iowa Heartland. We became an affiliate, and by we, I mean Project Adam. It was a little bit before I had started in my role, but through work of Trudy and another cardiologist, Dr. Law, we officially became an affiliate in October of 2021. So that was exciting. And I know there was a lot of hard work just getting the affiliation. And then once they got that, we had, if there's any Iowa Hawkeye fans out there, Jordan Bohannon, who is one of a previous basketball player at the University of Iowa, was generous enough to donate a nice amount of money to get our program off and started. They just, here's a picture getting a little money. Isn't it funny when we look at COVID pictures with all the masks on? So, and with that money, we had Dr. Stuart Berger, who actually was the Adam in Project Adam. It was the cardiologist that began this program. He came to the university and presented at Grand Rounds. And then again, there's must be after COVID because there's no masks on that one. So from there, we went and they did some training with the Iowa men's basketball team and then started working with schools. So here's some fun pictures from that. The first schools that were designated were actually 3 Iowa City high schools. I think that was low-hanging fruit because that was close to obviously where we are located. And it was a little bit easier just demographically to be able to help those folks. And so in October of 2022, Liberty City and West High were all designated, and they actually have just now recertified. So they have been redesignated again for another 3 years. So that is a fun step. And here they are with their banners that they all proudly hang in their schools. So then I onboarded in June of 2023. So once we got started, it was a little bit slow, but we have slowly but surely grown. The first year, you can see year and a half, we had 12 designated heart safe schools, but we're starting to make connections with a lot of folks. And we were figuring out the Iowa School Nurse Association and meeting some groups across the state that were interested in learning more about what we were doing. We did CPR and AED training with several University of Iowa sports teams. Again, that's low-hanging fruit just because it's close to our proximity. But we were lucky enough to train the men's basketball, women's basketball, gymnastics, softball, volleyball, baseball, soccer. We actually had a few local groups that we did CPR training with, including a group of young Cub Scouts and youth soccer. As you can see here, I joined the team in June of 2023. And then probably most importantly, after that, we had our first Heart Save School save at one of those 3 schools that was designated on the last screen. So I think that save happened a little under a year after they had become designated. So moving on to the next stretch, which was August 24 to December of 25, we increased up to 28 designated heart safe schools. So we had a total of 49. Again, my goal every year was just to have one more school than the last. So we were starting to hear positive impacts. We were hearing success stories from folks. Remembering while we all work in cardiology, we were recognizing that a lot of schools were using these teams not just for a cardiac arrest, but they were using these teams for medical events like asthmatics, seizures, someone who had syncopal events. So that was really inspiring, I think, to see what was happening across the state with the schools. We were able to collaborate. As a former peds ICU nurse, I had some experience working with air care, and so I thought it would be a good thing to try to collaborate with air cares, and we've been able to collaborate with several. We've collaborated with Air Care 4 which is based in the Quad Cities. Air Care 2 is based out of Waterloo, and then we actually collaborated with I'm not going to remember the name. It's a helicopter unit out of Omaha for a Southwest Iowa school. So we've continued to do training with University of Iowa student athletes, marching band, the Herky squad, the cheer squad, and I feel it's growing momentum because these teams are reaching back out and wanting to schedule yearly trainings, which is really great to see. We've been advocating for legislation about cardiac emergency response plans. And really our goal is that every school in Iowa be designated heart safe. That's a lofty goal, and even this map, I can even add more schools now. This was our map as of March, and we have had a busy spring. Just to point out, last year, the amount of schools we did from January to December of 2025, We will have more schools designated between February and May of 26 than we did all of last year. So it's really gaining momentum. So here's just a few examples. The bottom left, we are at the Iowa State Fair doing some CPR training. The top left was one of our schools in Eastern Iowa that collaborated with Air Care. We've got a couple of pictures from schools in the middle with their banners, and off to the right. Oh my gosh, I'm just noticing the fellow in there who just got drafted for a few days ago. So that was with Iowa football. So how prepared is your school? If you are sitting listening to this webinar thinking, what could I do this at my school? I think the first thing to do is to don't wait. Reach out to your school administrator, your AD, and maybe just start brainstorming a little bit, thinking about, do you have AEDs? Where are the AEDs located? Can people get to those AEDs and start making a plan? Project Adam has a load of resources. If you're interested in really thinking about what you could do, probably the first thing, there's a heart safe checklist that is located on the Project Adam website. And that is a good way to start just looking at the steps and seeing what you have at your school. If you want to do that, I mean, I'd be more than happy to look at things. If you wanted to reach out and send checklists my way, I can shoot you back emails with information and resources and maybe a plan of how you could achieve designation. The other thing on the Project Adam website, there is a school toolkit that you can find that literally will walk through each step. It gives you resources for each step. So that is a great thing too. We are happy and always like talking to folks. So there's an email that you can reach out to us and ask questions of, or I mean, you can phone, whatever works for you. But we are always happy to talk to folks and learn about what you're doing at your school. So, and I think just in closing, a quick reminder is whoever saves a single life is as if they have saved an entire world for somebody, and that is in fact the case. So, if people have questions, we'll be happy to chat.